Hi, we're here with Dr. Nunn, and we're asking questions about chin augmentations today. Dr. Nunn, what is a chin augmentation?
A chin augmentation is generally a procedure that's done to advance the chin of a patient.
What is the difference between a chin augmentation and a genioplasty?
Well, chin augmentation itself is usually done with an implant. It's either made from silicone or some other plastic-like material. A genioplasty is where the bone itself is actually sectioned and brought forward and then plated in position.
How do you know which one is the best option for a patient?
It all depends on what the patient's anatomy gives us. If it's just a straightforward advancement of the chin, generally you can get by with a chin implant with that. But if there's any asymmetry, or if the chin needs lengthening or shortening, or if the chin needs to be taken back, then you need to do a genioplasty. Also, some patients do not want a foreign body, which is in a chin implant, and we do a genioplasty for those. There's only a small plate or screws that hold the chin position in.
How is the surgery performed for a chin aug, and how long does it take?
Generally, if you do a chin implant, you use an extraoral incision where you make a small incision underneath the chin itself, which is hidden. And the reason we would place it underneath the chin through the skin is to prevent infection. For a genioplasty, that's done on the inside of the lower lip and is done transorally, and there's no skin incisions with that procedure.
And how long does it take to do each of the procedures?
Generally, it takes about 30 minutes, whether you're doing a chin implant or genioplasty for the actual surgery. It usually takes about an hour, considering being put to sleep and woken up from the surgery.
Okay. So will I have scars with one and no scars with the other?
Yes, like I said, with the genioplasty, it's done through the mouth. There's no scar with that you can see on the skin. I mean, you can see a small scar in the mucosa intraoral, but no one sees that when looking at you. With the chin implant itself, generally you can put those transorally without a scar, but there's a higher incidence of infection. But most people place them through a small incision underneath the chin, and that's a very hidden, concealed scar.
How painful is the surgery?
Some people feel like you may have a little more discomfort with the genioplasty. I personally, in my practice, have seen about the same amount of discomfort. It's not really a painful procedure. It's sore and swollen for a week, but it's just one of the less. It's one of the procedures that has less discomfort.
What is the recovery time?
Like I said, we usually put a bandage over the chin for about a week, whether I do a genioplasty or a chin implant, and that comes off at about 5 to 7 days. You still have swelling at that time, and most of the swelling tends to go down over 2 to 3 weeks after the surgery. It's a very small amount that's left in there at 4 weeks.
Okay. Are there stitches that need to be removed?
I do place stitches when I go extraorally for a chin implant that I take out at 1 week. When I go intraorally, I put sutures that dissolve and do not have to be removed.
Okay. Is my bite affected at all if I have that surgery?
No, with neither surgery is your bite affected. Even with the genioplasty, even though you're cutting the bone of the lower jaw, you do not change the teeth in their relationship to the opposite jawbone. So there's no change in your bite and no change in your occlusion whatsoever.
Well, if I have this surgery, how long would I be out of work or out of school?
I generally tell patients to give themselves a week, and most patients are able to return back to normal duties at their job or back to school by a week's time.
Okay. Well, thank you very much for answering all of the questions. You can contact Dr. Nunn's office at 404-255-2975.
Thank you.